Cancer is something that has significantly increased in the last few years. So a lot of patients ask us, so how come that every other person has cancer these days? So this is a very simple theory behind it. So any cancer in any part of the body, any organ of the body occurs because of some abnormality that develops in the genes of your DNA. So of your DNA, which are basic constitutional workup of your body. So a particular gene in a particular organ of your body going abnormal is how a cancer ultimately develops. And gene abnormalities increase with age. So each passing year of your life, you are increasing your chance of developing cancer because you are exposed to mutation creating factors in your environment, which may be an ultraviolet radiation, it might be your mobile phone, it might be some carcinogenic factor in the food that you eat, it might be the pollutants in the air. But each passing year of your life, you are increasing your chance of developing cancer. So that is one of the reasons why earlier people would die of cardiac issues or diabetes, but now people live all the way up to 90 and 100 years, and once you're past your 50 years, your chance of developing cancer is high. And the same applies to women cancers. So women's cancers, women are now reporting with cancer, at least reporting to the doctor early on. So the pickup of women's cancers have also increased, with breast cancer of course leading the topmost rank, and then followed by cervical cancer, ovarian cancer, and then uterine cancer. So most of these cancers have been more or less in the same trend. So cervical cancer, is linked with HPV infection and can be prevented to a significant extent by HPV vaccination as well as pap smear. Ovarian cancer, the only way out is, recognizing your symptoms and going to the doctor early on. Now coming to uterine cancer, so this is a cancer which was much lower down in that list of cancers and has now rapidly gone up, because uterine cancer is more or less a lifestyle disease. So this is almost like having diabetes, So people who have unhealthy eating habits are on the heavier side of your weight. People who do not have children, who have long-standing diabetes. So these are the women who are generally prone to develop uterine cancer. So I think especially in uterine cancer, there is a huge scope for lifestyle modification to prevent the occurrence of the cancer. So the women who should visit a gynecologic oncologist, I'd say, are women with any symptoms which are specifically related to the reproductive tract. So this could be in terms of menstrual irregularities, your period irregularities. This could be heavy periods, women having persistently heavy bleeding even in the younger age group. Women with long-standing polycystic ovaries who have bleeding irregularities. Women who have stopped their bleeding, meaning they have attained their menopause, but still again after a few years of not having bleeding, they again start to re-bleed. Ovarian cancer currently stands at around maybe the third in position with respect to women's cancers. And the treatment options for ovarian cancers have significantly improved, both in terms of surgical as well as non-surgical options. So in surgical options, there are additional treatments like improved treatments in terms of something that we call HIPAC, where chemotherapy is delivered into the abdomen at the time of surgery. There are advanced medical treatment options based on targeted therapies, where the tumor is tested for some particular changes and treatments are prescribed based on those changes, something that we call personalized medicine. And even in cases of cancer where it is beyond cure, as we would call it, there are surgical options such as PIPAC, wherein chemotherapy is delivered into the abdomen in an aerosol form or in droplet form and can significantly relieve the person's symptoms. Though it might not cure the disease, it can significantly relieve the person's symptoms and improve the quality of care or the quality of life that the person has. So some of the challenges that we face in this domain, one in terms of percolating the information to the general public, is that people are generally closed with respect to women's health. So even among women, so we encourage the women who have survived the cancers to talk about their journey through the treatment of cancer. So women do not want to talk about it. They prefer that other people around them not to know about what they have suffered from. Another major stigma that they have is the hair loss that occurs with chemotherapy, which significantly affects women. So they do not come to treatment, or they do not let others know about their treatment. So they want to be completely hidden during that. And as long as women do not speak up about their journey, and that does not encourage, or rather it discourages other women for going forward for cancer therapy. The ovarian cancer, unfortunately, is a disease which does not have significant symptoms in the initial phase. As a matter of fact, it has very non-specific symptoms. You know, ladies, usually women who are above the age of 50 are the ones who develop ovarian cancer, and they have non-specific symptoms like, you know, a little bit of bloating after you had food, don't feel like eating, reduced appetite, things like that. So even doctors ourselves are guilty of ignoring some of these, because, you know, the patient, you know, or a relative of yours will come up to you and tell, I have these symptoms. So we say, okay, just take an antacid. Even general physicians end up, you know, prescribing antacids to the patient, and the patient ignores the symptoms for several months until finally her abdomen bloats up. So this is the next symptom that we are going to expect, is bloating up of the abdomen with water or fluid inside. So that is usually a sign of very advanced cancer, because this is a cancer that presents in later stages, and when it comes back despite our treatment, it again comes back in the same stage as it was in the first appearance. So with a lot of bloating, the person is not able to take in food, there might be blockages in your food tract, you end up vomiting out. So this leads to the person, you know, losing weight significantly, not being able to eat anything. So this is not traumatic just for the person, this is also traumatic for the caregiver, meaning the relatives at home, to see your loved one losing weight every day and not being able to do anything about it. So you go to doctors, the doctors are also not being able to do much. However, this has changed in the last few years. Once we have separate departments called palliative medicine, which will handle these issues, which will help them deal with loss of appetite, pain, and your food tract blocks. We also have advances in surgery, as I've previously mentioned, something called PIPAC, which are procedures which will significantly reduce the water in the around the intestines. It will increase your the food tract movement and help you deal with these symptoms. So there are options to improve the quality of life currently. So ovarian cancer has definitely come up higher on the list of cancers affecting women from before. And you should know that a good majority of ovarian cancers are familial, are hereditary, which means that this can run across the women in your families. So you have to be aware of whether there is a family history of these cancers in your family. If you do suspect that there are some cancers like these, please visit the nearby oncologist or the cancer specialist. There are options now to test your blood to look if there is a possibility of having a familial cancer, and there are surgical options to prevent these cancers from happening. And yes, you have to be aware of your body and you have to be persistent on taking care of your health. If you have a persistent symptom, do not ignore it for the rest of your family. So it is very important, if you have to be there for your family, it is very important that women take care of their health first.